how did you handle the sample before you're making your blood smear? Are you mixing it well to make sure the cells are distributed well? All of those little factors. And I'm sure that we're doing a lot of those just automatically. They're lined out of this is just how you do this task, but just being aware of their significance of, if we skip those or if we don't pay close enough attention, it can really just cause a lot of problems when we get to that analytical phase when we're actually running the sample and trying to generate results.
Hey, VetFolio Voice family, welcome back. In this episode, I'm joined by Brianne Bellwood to talk about blood smears. More specifically, how to get the best diagnostic result by using some simple quality control steps and a solid, consistent approach to reading these slides. So for me, I'll admit, cytology, not my favorite skill. It feels a little bit intimidating, and it requires a lot of patience, which I'm not exactly known for. But Brianne did a great job of illustrating just how much valuable information blood smears can reveal and why it's so important to take this extra step rather than relying on just the information we get from our analyzers. And even I can admit, despite not loving my time at the microscope, without a doubt, blood smears have been one of the most valuable tools I've had when working up a sick patient. And of course, we talked a bit about what we're trying to identify when we're performing a blood smear, like red blood cell and white blood cell morphology, platelet clumping, and individual cell characteristics like toxicity or banned neutrophils and nucleated red blood cells, which analyzers might miss. And in order to get that information, we need to make sure we have a systematic way of making and reading blood smears and that we're familiar enough with the findings to know what's normal and what's not. Brianne and I talked about approaching blood smears the same way we'd approach continuing education for any other skill. It's something we can keep building on over time, and the more we do it, the more comfortable and more confident we get. This episode was inspired by an article that Brianne wrote for Today's Veterinary Nurse called Manual Blood Smear Preparation and Review, so be sure to check out that article. And in addition, she also left us with some great suggestions for resources if you want to up your blood smear game. Let me tell you a little bit about her and we'll talk blood smears. Brianne is a 2002 graduate of the Animal Health Technology program at Olds College in Alberta, Canada. Her work experience includes mixed animal rural practice for 6 years, after which she moved to a faculty position at Lakeland College Veterinary Technician program. In 2016, Brianne obtained her VTS certification in clinical pathology and was president of the Association of Veterinary Clinical Pathology Technicians in 2024. In 2021, Brianne completed a master's degree in advanced practice in veterinary nursing through the University of Glasgow. Since pursuing her passion in veterinary clinical pathology, Brianne has enjoyed opportunities to work with other veterinary nurses and technicians within Canada and internationally. All right, let's go ahead and get into our episode.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on vetfolio.com.
All right, well, I'm excited to be joined by Brianne Bellwood, and we're going to have a conversation, honestly, probably one that really needs to be had often and is a good reminder. We're going to talk about manual blood smears and preparing them and looking through them. So, Brianne, thank you so much for joining me.
Thank you. Thank you, Cassie, for having me. I'm excited to be here.
Yes, I'm excited to have you because this is one of these where I don't know, hopefully this isn't just me. I don't think it is where I'm going, I know I should probably be doing these more often than I am. So I guess my first question to you would be when we're thinking about manual blood smears, what is your take on manual blood smear for every patient?
Yeah, that's a great question because that comes up a lot. And even when we're talking about, do you look at blood smears in clinic as a routine? And sometimes the answer is yes, but only if they're sick or
Right.
only if there's some flags or abnormalities. I do think that there's a lot of value to be gained from looking at every patient. Of course, if you have an ill patient or blood results that are abnormal in some way or just even unexpected, yes, you want to investigate those a little further. But you might catch something that wasn't flagged in a, quote unquote normal patient. And I think you do gain a lot of expertise by reviewing normal blood work of, let's say, normal meaning normal parameters. The patient seems healthy. There's no expectation of any abnormalities there. You develop a really solid baseline of what your reference should be. So, for example, if I routinely look at blood work from dog patients regularly, and a lot of them are happy, healthy dogs, then when a sick one or an abnormal one comes along, it's going to stand out to me quite a bit more obviously. So if I'm looking to expand my expertise on how to look at abnormal blood work, it's really going to be beneficial for me to know what my reference is. Then, when something abnormal, a little bit different comes along, it's going to jump out at me because it's not something I'm used to seeing all the time. So, I do think that that is a really valuable skill to have. So, yeah, I do think that it is worth it for sure.
Man, that's a really good point. Because I'm thinking, a lot of our wellness blood work in our happy, healthy dogs goes out to the lab. And so it's reviewed there. And we don't generally have those samples in clinic to review. But I think you make a really good point that certainly I've been there when I do have a sick patient and I do a blood smear and I'm sitting there and I'm looking at the cells and I'm going, okay, I think, this is what I'm seeing and this seems to be a result of X, Y, and Z. But having not looked at these routinely when it comes to healthy blood work, I can absolutely appreciate how it can be hard to have a frame of reference there and know, is this normal? Is this, an artifact because it took me a little while to make the blood smear? I didn't make it right away when I drew it, and different just kind of subtle changes that we might appreciate and knowing when those are normal and when those aren't. On the other side of the coin, fully appreciating the busy workflow in a clinic and that's not always possible to look at blood smears on our happy, healthy patients. But to your point, which I think was a really good one, that if we do want to expand our cytology skills and our blood smear reading abilities, then we do need to be looking at these in healthy patients as well. So, I guess understanding and being familiar with the busy flow of a clinic and that, maybe it's not possible on all of our healthy patients, but certainly something that's really valuable and can come in very helpful when we are seeing these sick patients and trying to make an evaluation off these blood smears.
Yeah, absolutely. And even if you look at it from the perspective of, think of it as almost a CE or, investing in yourself of, we don't have the time because we're busy, we're shorthanded. I get that that is the norm most of the time, but the more proficient I could be, the faster I'm going to be at this. So if it's a goal of yours, then think about, well, how can I maybe approach this? Of this is almost like CE. So if those smears are stained, is there some time I can set aside where I can look at those the same way as, I'm going to attend a webinar to improve on my skills. So yeah, you can think of it as that way of, you're investing in yourself and you're just trying to expand your skill set.
Yeah, absolutely. I think that's the perfect way to look at it. Of, we set aside time to work on other skills and to learn about other conditions, and this being no different, that we're going to set aside some time to look at slides and really try to interpret them. So, thinking back to vet school and learning how to make these blood smear preparations, I've told this story before because it's one of my very favorite stories from vet school that one of our clinical pathologists Jen Owen, who I love to pieces, she was trying to show me different techniques for making a blood smear. And I will never forget her looking at me and saying, Cassie, it's a really good thing that you like anesthesia because you will never make a blood smear.
Oh
And
no.
I'm happy to report I think I can make a halfway decent blood smear at this point, but it did take a lot of practice. But it can be a challenge. Like it's not something I think that everybody picks up on naturally. Well, I can promise not everybody picks up on it the first time from personal experience. So I guess, do you have some tips and tricks in mind for making a good quality preparation that we can examine and get the information that we need from?
Yeah, absolutely. There's a lot of different styles and techniques. I teach this subject at Lakeland College, so I see a number of students every year practicing, and I one of the things that I emphasize to them is it doesn't really matter too much what technique or what approach you have. It's the end result. So I need a decent monolayer, so I have a good area to examine. I want a blood smear that's a decent enough size so I don't run out of space. I don't want to have a lot of tails or those types of things. However, you twist and contort your body and your arms to get that done, you do you, and that's perfectly fine. And I've seen some very interesting techniques, but it works, and I've tried to do them and I can't do it. So whatever works for you, standing, sitting, all of that, but play around with it and figure out what works for you. I think that this goes back to what we were talking about before about just exposing yourself to multiple opportunities, because you might do well with, you're figuring out how to make this blood smear and it works great. And then all of a sudden you have an anemic patient and their blood is much more of a watery consistency and you need to adjust your technique because it's going to spread a lot easier. Or you have a dehydrated patient and their blood is very thick and you're going to have to adjust your technique there. So being flexible enough that you can just modify, your angle and your speed. And as long as you hit that goal of what a smear should look like and you have a good monolayer, then that's great. Then you're golden and you've got a pretty good slide that you can get your work done on.
Sure. I think that's really good advice there to make sure that we're kind of just open to using different techniques for different patients. I'm with you that I've seen some people make them in ways that I'm like, I know it does not work in my hand. Like I like the pull method. I
Mm.
don't the push, like, nope, it doesn't work for me at all. Occasionally, like I've been known to sandwich my sample between two slides, but I think the biggest thing for me was when I was learning to make these preparations, using a small, like it's like exactly the right volume of blood that you need. And you're right, it depends on the patient. Because
Mhm.
initially I was using way too much. And then so I tried to back that off. But there is such a thing as not enough blood too. So it's really finding the right technique for that patient.
Yeah, yeah, absolutely. And just to be fair with yourself, sometimes it's just a bad day for blood smears. And you do the best you can. And again, it's about, is it diagnostic quality? And if it is, great. Don't worry about if it's not symmetrical or if the base isn't quite right, or if it's diagnostic quality, then it's good. It's good enough to look at and you're good to go.
I love that because yeah, you're right. We have our bad vein days where we can't
Yep.
place an IV, we can't hit a vein to save our lives, and that makes sense that it would happen with blood smears too. It is kind of I mean, there's definitely technique that goes into it.
Yeah, absolutely. There's a lot of muscle memory to develop for that, just with any skill. So yeah, yeah, don't be too hard on yourselves when you're when you're struggling.
Absolutely. Do you have tips for us when we start to examine the slide itself for really evaluating that slide effectively?
Personally, I like doing a bit of a methodical approach. When I'm looking at the smear and thinking about what magnification I'm going to be using to examine the smear. So I'm thinking about, I'm going to be starting on a low magnification, so using my 100 objective or my 10 objective lens, and then going up to my 40 and then going up to using my 100 objective lens with oil. It just feels like a logical flow to examining it, and oil's gonna get messy, so I'm going to save that to the end. So I like to start off with the 10 objective, and it's really a broad view of the smear. I can't see small details of cells. I know that, but I can see if there's going to be clumps or larger clusters of cells. Platelet clumping would be a great example of that. So, I'm looking out on the feathered edge, just scanning really quickly. You can cover a lot of ground when you're under that magnification. So that's where I'm going to see some of these larger elements that could potentially be there. And sometimes if you're looking close, you might miss some of those larger elements because you're zoomed right in. So taking that first scan of when you're looking a little bit further back. And then, once I have a scan there, then I'm going to go move up to using my 40 objective lens. And Here I can get a little bit of a closer view. I might be able to make out different white blood cell types, like for example, a neutrophil versus eosinophil. The details aren't going to be very clear, so you still might struggle with that. And I'm not going to be able to make out the morphologies. For example, is it a toxic neutrophil? The red blood cell morphologies. They're just going to be too small at that objective lens. But what I can do at this magnification is I can assess density. So, for example, if my analyzer is reporting a very low white blood cell count, when I'm looking under using my 40 lens, I'm going to see this sea of little pink dots of my red blood cells, and I'm going to have these purple white blood cells in amongst there. They should be fairly spread out. They shouldn't they should have a very low density, and that would match what my analyzer is saying. On the flip side, if it's a high white blood cell count, they're going to be all over the place. So I can help confirm some of those values that the automated analyzer are generating, especially if maybe what the numbers it's spitting out is a bit of a surprise. You didn't expect that with that patient, or maybe it just doesn't quite fit what you thought you'd see. But we could look under there and we could confirm, no, it really is high. I'm seeing a very big density. And I'm not doing counts or anything like that. I'm just looking at densities. And if I can see some what look like eosinophils, for example, and there's quite a few of them, I come across them very frequently. Well, that maybe should jive with what my analyzer was saying of reporting a high eosinophil count as well. So I can get a little bit of information from that just with scanning a few fields. Then when I'm satisfied with that, I'll go up to the 100 objective lens, and now I can see those more intricate details. So I can look at morphologies of the red cells, the white cells, and the platelets, and comment on some of those abnormalities. I can investigate some other things. If there was nucleated red blood cells there, at a lower magnification, maybe they might have looked a little bit like small lymphocytes. I don't really know. Is my analyzer being tripped up by the presence of nucleated red blood cells? And I really want to confirm their presence. So now I can be much more confident knowing that they're there. Toxic neutrophils, different platelet morphology. So I can look through a lot of those much more clearly in the monolayer, scanning a few fields and starting to get a sense of how frequently some of these morphologies are coming up, and does it match what we're seeing with the analyzer, or am I also gathering information that my analyzer can't give me, like morphologies? I can add to that overall report of findings and make it a bit more complete.
Right, right. Yeah, I love that you talked about scanning on a lower magnification and then working your way up to that 100, because I think my instinct is to go straight to 100x because that's when I'm going to see my morphology and, kind of be able to identify these different cells. But back to what you were saying before, if we're looking at some of these slides a little more frequently, I can absolutely appreciate how getting a high level view would, just how much purple is there? How dense is it? Is that what I'm used to seeing? Or, is there more? Are there, clumps of areas that I need to examine a little bit more closely? I could see that being just kind of a good initial gut check of like, okay, this is what I'm used to seeing, or oh no, there's something funky here, and I'm definitely going to have to dig deeper and figure out what this is. I agree with you. It seems like a really methodical approach that makes sense and probably gives you much more just the whole picture compared to going straight to 100x and then trying to make sense of what you're looking at.
Yeah, absolutely. It's like getting a lay of the land type of a thing, and it should be pretty quick. We're not spending a ton of time because we're not going to get a ton of detail, so it shouldn't really add too much to that workflow. Just a few quick scans of some areas, and that you know what to look for and what you're keeping your eyes peeled for, and hopefully either you see it or you don't, and then you move along.
Sure, sure, absolutely. And get on to that 100x and seeing what those morphologies look like and all of that. So along these lines of looking, working our way up from a lower objective and how we're going about examining this slide, one of the things that you and I talked about before we turned the microphones on was quality assurance. And so we talked about pre-analytical, analytical, and post-analytical quality assurance when we're looking at these slides. Can you tell us a little bit more about what those terms are? And even if we're not, maybe using those specific terms when we're looking at slides in practice, just the general principles that they kind of remind us to keep in mind when we're looking at these things.
Yeah, absolutely. I know when you start saying things like quality assurance and stuff, people's eyes glaze over a little
Sure.
bit. But there's stuff that we're probably doing every day with a lot of the different aspects of our different tasks in the clinic. But like you said, we're just not using those terms. But when we're thinking about it, specifically related to, let's say, blood smear analysis, my pre-analytical, that is everything that is leading up to the analytical or the testing stage. So things that we want to keep in mind of quality assurance, checklists and best practices. And this is all to make sure that I have a good quality sample so that my results are accurate. Think of it almost as setting yourself up for success. So this could be anything ranging from, just the initial communication with the client at the start. So were there some patient prep type instructions? Did this patient need to be fasted? And were they fasted? Was that essential for this test, or is that information that we need to know? What is the history on this patient? Are they on any medications or things like that that could have an influence on my results? And when we're reporting results and when the veterinarian is interpreting them, that would be an important piece of information to know. They would want to interpret them knowing that this patient has been receiving this type of medication for an extended period of time, or however that may be. During the collection process, how did that go? Was it a pretty easy collection process? Was there some challenges? Was it difficult? Were there delays in collection and getting it into the anticoagulant? Things like platelet clumping, for example, could be a consequence if there were some challenges in that. And that's going to affect my platelet values, whether they are automated platelet values that are generated or looking at them on a slide. So knowing how that process went, if you're the one looking at the smear, you might not be the one who is collecting it. So getting up to speed on those details. And, how did you handle the sample before you're making your blood smear? Are you mixing it well to make sure the cells are distributed well? All of those little factors. And I'm sure that we're doing a lot of those just automatically. They're lined out of this is just how you do this task, but just being aware of their significance of, if we skip those or if we don't pay close enough to attention, it can really just cause a lot of problems when we get to that analytical phase when we're actually running the sample and trying to generate results.
Sure. I can absolutely appreciate how this is something we're doing already. For example, I know when we run samples in-house, of course, that platelet count can be quite variable. And a lot of times we see a low count and we then go confirm that indeed it's clumping. And that's a piece of information that I think we just kind of readily have available. Like, oh, this platelet count is low. Oh, well, it was a tough draw. The animal's
Mhm.
dehydrated, so it flowed really slowly. We did our best. Similarly, CK levels are another one, which of course is more related to chemistry, not blood smears, but coming back, oh yeah, it was a really, squirmy cat or whatever it was.
Mhm.
And that's why we see these levels as being elevated. And so I think that makes a lot of sense that these little details surrounding this specific patient make a big difference when it comes to how we're interpreting the results.
Yeah, absolutely. And if you're working on a larger team, this could go through several hands. So the person getting the history from the client and collecting the blood, analyzing the blood, interpreting the blood, those could be all several different people. So making sure that all of that stuff is documented and communicated so everybody understands, that you're minimizing those miscommunications and, when the veterinarian is interpreting the results and then reporting those to the client, they have the full picture,
Sure.
and they can, was this a sample collection challenge, or is this maybe indicative of an actual disease process going on? So that's going to decide on which direction I'm going to pursue with this patient.
Absolutely. Yeah, it makes a huge difference. I think that speaks a lot to that pre-analytical side. What about analytical and post-analytical?
Yeah, so analytical, that is going to be in the testing phase, and whether this is automated or manual. So a lot of this it surrounds the equipment and tools that we're using to perform those. So an easy example would be our automated analyzers, but you could also talk about your microscopes and your other equipment that you use to perform these evaluations. So thinking about how do you maintain that equipment? Are you practicing regular maintenance and calibration according to what the manufacturer suggests? Are you performing quality control, or maybe it's a internal quality control that the analyzer performs automatically on its own, or it's external quality control, which is a quality control procedure you as an operator would have to conduct, whether that's a weekly task or a monthly task or whatever the recommendations are. So this is all different processes that we do to make sure that our equipment is functioning properly. So let's say when we have some results and there's suspicion that maybe they're not accurate or that there's some confusion with them, when we're trying to troubleshoot of, well, it can't be this, it can't be that, looking back at our analyzer saying, well, it's been properly calibrated, we keep up with our regular quality control, we maintain it properly. So when we're trying to troubleshoot some of those problems, and we're trying to rule out things that could possibly be to blame, and having good practices around that analytical portion is, again, just another step to ensure that our results are going to be accurate.
Sure. I'm thinking like, are you a mobile vet? And maybe your microscope gets jostled around a little more than it should.
Sure, absolutely. And that just gets knocked out of alignment. And it may interfere with your ability to visualize things really well. And any other kind of, your reagents that you're handling, whether those are reagents for your analyzer, or you can extend that to the stains that you're using. The more we maybe just let some of that stuff go, it's just gonna, it introduces a bit more questionable possibilities for errors into how valid our results are.
Sure. And so listening to you talk about the pre-analytical and the analytical, I'm assuming that our post-analytical is going to be how we're reporting our results and making
Yes.
sure we're doing that in an accurate way that's easy to interpret, easy to retrieve, and really can be, I don't know, useful when it comes to interpreting the results.
Yeah, so this is how we record those results, and if this is a combination of the analyzer results plus your additional manual review that you're adding to it, and it's a complete reporting of those results. Are we reporting them consistently? So, I'm sure you're familiar in clinic where we might use scales like the 1+, 2+, 3+ method when we're talking about morphologies or things like that, or you might use terms mild, moderate, marked. Are we consistent with that? So if I record something as 2+, does my 2+ mean the same as your 2+? Hopefully it does. So making sure that we report things accurately. When other things that would fall under that post-analytical is this whole process of how we go about reviewing, say, a blood smear or performing a CBC, that should be outlined in an SOP somewhere. Do we revisit that regularly on an annual basis? Do we revise that, update it as needed? All of those types of things. That just, can make sure that we are staying up to date and we're trying to maintain that high level of quality. And then we can think about our personnel too with the post-analytical. So communicating our results to the veterinarian, communicating results to the client, making sure that that is done correctly. And then just thinking about that team as well. Are we all staying up to date with our continuing education? If we want to revise our SOPs, or maybe a new technology comes out, or we get a new analyzer or something, do we all know what that's about? Or maybe we need to just brush up on our education to stay up to date. So it's a quite a holistic piece, and it's basically just making sure that we've led up to this point of having, as best as we can, accurate information. How do we then communicate that and get that out in a proper way?
Sure. And I love what you're saying there about, having an SOP, making sure that we're all on the same page. One thing that I kind of keyed in on there was, does my 2+ equal your 2+? Because I know that's something I've certainly run into where, I'm thinking more specifically with like an ear cytology or something. I've
Hmm.
heard, oh, it's TNTC, it's too numerous to count. And I've gone and looked and I'm like, I could count those if I really wanted to. I wouldn't call that too numerous. And so, yeah, so making sure that, whether you write that out numerically of, 2+ equals this many per high power field or whatever it might be, or you do it in a diagram form of, if it looks like this, we'll call it 2+. It makes a lot of sense to me how having that very standardized can go a long way in just accurate interpretation.
Yeah, and having that somewhere that should be in your SOPs, but you could have reference sheets, cheat sheets, just somewhere in the lab where you can grab those handy. Super helpful, especially if you ever have new staff coming on board. So new techs, new veterinarians, just if here's how we do things here in our clinic. If you have a go-to reference if you're wanting to make sure that you report things the same that we do, or so that is really helpful. And I think if anybody's been in that situation when they've been the new person, anything, your anesthetic protocols, all sorts of stuff. It is really helpful if that is just spelled out somewhere, and it should be spelled out somewhere. Where can you go find that? And so you can get some answers and you know who to ask, and yeah, to familiarize yourself with the protocols.
Yeah, that makes, yeah, just write it down. I couldn't agree more. It's so hard to do it. But then when it's done, it just, yeah, it makes it easier for everybody. Can you give us an idea when we are looking at these blood smears of some of the characteristics of different cell types we might be looking for?
Yeah, so if we think about our three categories, if we talk about our red cells, our white cells, and then our platelets. So for our red cells, a lot of the different morphologies, and we could probably all go back to school when we learned all of the big long names of the different shapes and their indications, whether they're associated with sample handling artifact type issue, or whether they are indicative of a disease or something. So we were looking at a few of those types of things. Inclusions in the red blood cells, nucleated red blood cells, as I mentioned, possible parasites, hemoparasites that you might come across. That's another one that's really handy to have some kind of reference sheet, because there's a lot. And if we've got like codicytes, keratocytes, I mean, there's all of those words that end in site and all of the different shapes. So having a reference, and how significant is it? If did I see one and when I was searching through my blood smear and that's all I saw and I never saw anything else again? Is that something to be concerned about? It depends on maybe what it is. So yeah, those are for some of our characteristics in our red cells. For our whites, obviously we have our cell types, our different white blood cell types. For our neutrophils, we should really be examining immature versus mature. So do we see some band neutrophils versus mature neutrophils? There is looking at the characteristics of their nucleus, and our bands should have a lack of segmentation. They should have a fairly consistent thickness of that band. Often they are horseshoe shaped, U-shaped, but they don't have to be. But that could be a good sign that maybe you've got one. And then on the flip side, as neutrophils get more mature, we start seeing hypersegmentation. So that would be another thing to comment on if we're seeing a high level of those. That could be tied to maybe this is a stress leukogram or something along those lines. So it would be something worth mentioning for sure if it's a characteristic you're seeing. Toxic neutrophils with our lymphocytes, reactive lymphocytes, all of these little characteristics that our analyzers can't pick up. And it's something that, we can see by examining that smear for some of those different types. And even if, I try to, when I'm talking with my students at that level, even if you're not sure what it is, at least just describe it, or ask somebody or say, you know what, if you can, like, this doesn't look normal, I think this might be something, then ask somebody or describe what you see. If this is something, maybe we're going to be sending it out to a reference lab because we're a little bit stumped, but we can put in some descriptive terms of, we're seeing these types of cells. Can you, take a close look at that? This is what is kind of stumping us up. And you can talk about color and shape. Are there inclusions? So commenting on those. And then for platelets, looking at the size of platelets, are we seeing larger than normal platelets? These megathrombocytes, which are not uncommon or unusual to see in cats and some breeds of dogs. The platelet clumping, which we've touched on a couple times, which is like the bane of resistance all the time.
Always.
Yeah, very large, clumps that might exist. They might be further out, pushed out to the feathered edge of the smear, but even within the body of in the monolayer, are we seeing little clusters of platelets, and they're not evenly distributed anymore because they're clumped up. So commenting if you see some of that would be one example for some platelet morphology that you might want to mention.
Sure. And I want to go back to the neutrophils real quick. I love that you spent some time on those because I think that can go back to our SOPs. One thing I've struggled with in the past has been, is this a toxic neutrophil or not? And one thing I found is staining protocol makes a big difference.
Hmm.
And sometimes really, I guess, really sitting in that purple stain can make some changes. Or also, if because things come in waves in the clinic, right? So all of a sudden you're seeing lots of sick patients and having to do a lot of blood smears. And when I've looked at samples back to back, it has kind of occurred to me of, okay, I'm kind of seeing this trend where the neutrophils, like, this is how they are appearing to me, and that's not actually a toxic change. Like, this is an okay neutrophil. Thinking about the types of cells that we're looking at under the microscope, it goes back a lot to what you're saying of having those SOPs, making sure that we're following the same protocol every time. So our staining is the same every time, and those cells are going to look the same every time. And then, sure, reviewing different samples. So when we do see something we might interpret as a change, we can just have a better feel of is that something abnormal, or is that something that, we're seeing on most of these samples? And in my brain, I think the cytoplasm looks a little darker, but actually, no, that might just be what it looks like.
Yeah, absolutely. And having reference photos if you can, and like those little cheat sheets and easy access to those, that can be really helpful. And whether it's something you just, as you were kind of talking about, you do it in your head, or maybe it's spelled out somewhere of I'm seeing this, what's my troubleshooting guide? So if it doesn't make sense, well, could this be, is it a staining issue? Well, did I follow the proper staining protocol? I'm not, let's double check that. Or is this a sample handling issue? Let's maybe double check how the collection went, or even just handling the sample in the tube. Was this blood collected yesterday and we're just looking at it today or
Sure.
something? Is something like that too. So yeah, always be free to troubleshoot yourself. If you run into something that you just think, what could this possibly be? And can I go back into the stages of getting to this point of analysis? Maybe there is something that explained it. Feel free to troubleshoot and question some things. Absolutely.
Yeah, yeah, and be open to the fact that there are multiple layers of interpretation or of preparation and handling
Hmm.
where changes can happen. Brian, you have said a couple times the importance of having cheat sheets, having some reference materials, things that you can go and look back to see, all right, what really am I seeing here and how do I interpret this? Can you offer some good resources for those of us like me who are listening to you and going, okay, I'm convinced I need to make sure that I'm, really looking at these smears and aware of all the different changes that are out there?
Yeah, for sure. There's quite a few out there, and one website that I go to a lot, it's bookmarked, is the eclinpath.com
Yes,
website.
me too.
I really like that one. I mean, they have great information. I also really like it because it's very easy to find information on the website, because that's, yeah, if you're just looking for an answer and I just want to find it quickly. Great information. There's lots of pictures, which is really helpful. They've got great videos, and the cases that they have in there too, the case studies are really interesting as well. I don't work for eClinPath, but I'm just selling them great here. But I
Oh,
think it's a
they're
great,
fantastic.
yeah, it's a great website. So that's one that I'll refer to quickly. I have a few really handy textbooks that I like. Another great resource, it's the website for my VTS Academy. So it's the Academy of the Veterinary Clinical Pathology Technicians. Our website is avcpt.net. And so we have a few links on that website of other handy websites and resources to go to. And in the menu, if you go down to candidate resources, this is more geared towards if you were applying for VTS, but there's a great comprehensive list of recommended textbooks in there. So separated out by topic to a hematology textbook, a cytology textbook, urinalysis. So I think having a few really good textbooks on hand is helpful too. Yeah, just having those at your disposal, and whether it's something that you just jump to real quick because you've bookmarked it, or maybe you take some information and you create your own little resource that you just keep tucked away in a drawer, where like a quick reference guide, someplace where you can go to real fast just to get some answers. I think those ones are really great.
Sure. And pictures worth a thousand words, right? Just having
Yes.
those images to compare to makes a huge difference.
Yeah, pictures really help. The one challenge I think with pictures, and I'm guilty of this too. I've authored a couple books and edited some. When you want to add a photo, you tend to want to find a really good picture of, like, oh, this is a great one of this toxic neutrophil, for example. So I'm going to find a really great one, and I'll put this in there because it's a great representation. real life, you might come across something that's kind of beat up and you're not really sure what it is. So sometimes the pictures, seeing a few of them, because sometimes they look a little too perfect because we're maybe intentionally trying to put a really good example of one that clearly shows what we're looking at. But what you see under your microscope might not be the best example, but you still need to try to have some sort of tools to figure out what it is.
I think that's a really good reminder because certainly, I mean, hence the term textbook example, because
Yes.
those are always the perfect examples. So, yeah, I think that's a really good reminder to think about what we're seeing under the microscope and realize if it doesn't perfectly mirror what we're seeing on a website or in a textbook as that quote unquote textbook example, that it doesn't mean that's not what we're seeing. It just might,
Mhm.
we have a different patient in front of us.
Yeah, yeah. So having a few places to go for resources, seeing a number of examples, great if it's a few examples across a few different species, seeing the variation. So yeah, it's just building that library of resources that can really help. And of course, as you get more proficient at this and more comfortable, you're going to go to those resources less and less because it's just going to be a part of your skill set. So, but having those at hand if you need them is really valuable.
Absolutely. No, that makes a lot of sense. Well, I think you have made a very clear point on how important it is to just have this as one of our skills and not just pull it out when we're looking at a sick patient, but really to have a degree of proficiency and be able to understand what we're looking at, which comes from examining multiple samples of healthy patients as well as sick patients. And lots of great tips for how to examine these, how to prepare them, what we're looking for, how to report them. So, Brianne, thank you so much for joining me for such a great conversation. Any final thoughts you want to share?
It's a subject matter that I'm really nerdy about, and so I love talking about that, and I definitely appreciate some of the challenges that technicians face in practice. I would reiterate that think of it as investing in yourself, and it is providing really great care to our patients, and really amplifying our role as technicians in the vet clinic. So yeah, I hope that maybe those who are doing this quite a bit continue, and those who maybe want to do more but are running into some roadblocks maybe have some tips and some help to maybe get them to where they want to be.
Absolutely. No, I really appreciate it. And yes, I agree when you say amplifying technicians' roles in the clinic. And of course, I'm listening from the DVM standpoint, going, man, I really need to brush up on my blood smear skills too. So definitely applicable across the clinic, just a really valuable skill in general. So thank you again.
Yeah, thank you.
Brianne, thank you so much for joining me. I really enjoyed your article in today's Veterinary Nurse, and this was a fantastic follow-up conversation to that. A big thank you to everyone out there who tuned in. I hope that you, like me, are ready to up your blood smear game after this talk. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts to help other veterinary professionals like you find this and other great content we try to put out there. For more episodes, click on the Education tab on the VetFolio website. As always, we'd love to hear your input on this talk as well as ideas of what you'd like to hear from us in the future. So reach out to me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM or on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.